بسم الله الرحمن الرحيم. اليوم المحاضرة نتكلم بها عن structure مهم وهو ال face. So the face بلش بالسكن أو the face. ما موضح بالصورة عندنا السكن possesses numerous sweat and sebaceous glands connected to the underlying bones by loose connective tissue in which embedded in the muscles or the facial expression. بالنسبة للفيس there is no deep fascia. Now هذا section of the skin should be on the surface هو الهير shaft. عندنا the stratum corneum اللي هو الهورني أو الخلايا المتقرنة اللي تكون لنا surface of the skin. We have the melanocyte اللي هي تنطينا التصبغات مال الوجه. كل ما تكثر الميلانوسايت تكثر طبعا يزداد اللون. يعني البشرة الفاتحة تكون ميلانوسايت قليلة بها، والبشرة الداكنة تكون بها الميلانوسايت كمية أكبر. عندنا السويت جلاند وعندنا السيبيشيوس جلاندز. عندنا السويت جلاندز two types، عندنا إكراين and أبوكراين. إن شاء الله تأخذوها بالهيستولوجي. عندنا الطبقة اللي بعدها هو الأديبوس تيشو. طبعا in general هي تتقسم إلى epidermis وديرمس وسبكوتينس layer. هذه هي muscles of the facial expressions. The sensory nerves of the face. عندنا these nerves give sensory supply to the skin of the face. Proprioceptive. ذكرنا أكثر من مرة شنو معنى proprioception اللي هو the sense of the position أو the sense of the movement بالنسبة للspace. So fibers to the underlying muscle of the facial expression. وعندنا another sensory اللي هو supply the mouth, the teeth, nasal cavities and paranasal sinuses. يعني mucosal surfaces. أكثر من مرة ذكرنا أنه mainly هو الفيس supplied by sensory nerve from the trigeminal nerve بأقسامه الثلاثة اللي هو الophthalmic branch أو ال V1 والmaxillary branch or the V2 and the mandibular branch the V3. مثل ما موضح بالصورة هذا التريتوري مال الophthalmic nerve supplies the skin of the forehead, upper eyelid, conjunctiva يعني السيرفس مال eyeball, the side of the nose down to the down to and including the tip of the nose. هذا رسم آخر واضح أن the V1 V2 and V3. لما تشوفون V1 the upper face, upper eyelid and the nasal bridge to the nasal tip. So we have 5 branches for the ophthalmic nerve. We have the lacrimal nerve, supplies the skin and conjunctiva of the lateral part of the upper eyelid. We have the supraorbital nerve, divides into branches that supply the skin of the conjunctiva on the central part of the upper eyelid, also supplies the skin in the forehead. We have the supratrochlear nerve divides into branches that supply the skin and conjunctiva on the medial part of the upper eyelid and the skin over the lower part of the forehead, close to the median plane. These, the supratrochlear, the supraorbital, the lacrimal. We have the infratrochlear. عندنا supratrochlear أكو واحد جوا سواء infratrochlear nerve leaves the orbit below the bully of the superior oblique muscle. تعرفون إنه superior oblique muscle بها bully اللي هو يغير الاتجاه مال حركة العين. فهذه below the bully of the superior oblique muscle supplies the skin of the conjunctiva on the medial part of the upper eyelid and the adjoining part of the side of the nose, يعني root of the nose. We have the external nasal nerve, leaves the nose by emerging between the nasal bone and the upper nasal cartilage. Supplies the skin on the sides of the nose down as far as the tip. We have the V2 or the maxillary division. The maxillary division supplies the skin on the posterior part of the side of the nose. We have the lower eyelid, the cheek, the upper lips, the lateral side of the orbital opening, the branches. We have the infraorbital nerve, direct continuation of the maxillary nerve, enters the orbit and appears on the face through the infraorbital foramen, supplies the skin of the lower eyelid and the cheek, the sides of the nose and the upper lip. We have the zygomaticofacial nerve, supplies the skin over the prominence of the cheek. The zygomaticotemporal nerve supplies the skin over the temple. هذا هو zygomaticotemporal بالضبط فوق الtemple, this side of the cranium. We have the V3 or the mandibular division of the trigeminal nerve. The mandibular supplies the skin of the lower lips, lower part of the face, the temporal region, part of the auricles, كلها supplied by the V3. The branches, عندنا three main branches. The mental nerve emerges from the mental foramen of the mandible and supplies the skin of the lower lip and the chin. هذا هو التريتوري مالت المنتال nerve. We have the buccal nerve emerges from beneath the anterior border of the masseter muscle and supplies the skin over a small area of the cheek. هذه هي الاريا موضحة. We have the auriculotemporal nerve ascends from the upper border of the parotid gland between the superficial temporal vessels and the auricle, supplies the auricle, the external auditory meatus, the outer surface of the tympanic membrane, the skin of the scalp over the auricle. We have blood supply. Start with the arterial blood supply of the face. The two main vessels are the facial artery and the superficial temporal artery. The facial artery arises from the external carotid, arched above and over the submandibular salivary gland, curves around the inferior margin of the body of the mandible are the anterior border of the masseter muscle. It hears, it is heard that the pulse can be easily felt. أي واحد يحط إيده بهذه المنطقة inferior margin of the body of the mandible ممكن يحس pulsation. Runs upward in a tortuous course toward the angle of the mouth ما موضح بالصورة and is covered by the platysma and the rhizorius muscle, ascends deep to the zygomaticus muscle and the levator labii superioris muscle, runs along the side of the nose to the medial angle of the eye, where it anastomotes with the terminal branches of the ophthalmic artery. The branches, the submental artery, arises from the facial artery at the lower border of the body of the mandible, supplies the skin of the chin and the lower lip. We have the inferior labial artery, menisma, rises near the angle of the mouth, runs medially in the lower lip and anastomoses with the philo يعني الشبيه مالته ديتي من الصفحة الثانية from the opposite side. The superior labial artery arises near the angle of the mouth, runs medially in the upper border of the lip, and gives branches to the septum and alae of the nose. The lateral nasal artery arises from the facial artery alongside with the nose, supplies the skin on the side and the dorsum of the nose. هسه نجعل superficial temporal artery and its branches. Smaller terminal branch of the external carotid commences in the parotid gland, ascends in front of the auricle to supply the scalp. The transverse facial artery هو branch of the superficial temporal artery arises within the parotid gland, runs forward across the cheek just above the parotid duct مثل ما موضح بالصورة. عندنا هسه الفينوس درانج of the face mainly هو الفيشل nerve facial vein formed at the medial angle of the eye by the union of the supraorbital and supratrochlear veins, receives the tributaries from the that correspond to the branches of the facial artery. يعني أغلب البرانشات هي تكون companion venous branch. The facial vein descends behind the facial artery to lower margin of the body of the mandible. It crosses the crosses superficial to the submandibular gland, joined by the anterior division of the retromandibular vein. ايش راح يسوي لنا؟ ends by draining into the internal jugular vein. The facial vein connected to the superior ophthalmic vein directly through the supraorbital vein and then to the cavernous sinus. It's joined to the pterygoid venous plexus by the deep facial vein. Transverse facial vein joins the superficial temporal vein within the parotid gland. The lymphatic drainage, we have the lymph from the forehead and the anterior part of the face goes to the submandibular lymph nodes. The lateral part of the face, including the lateral parts of the eyelids, to the parotid lymph nodes. The central part of the lower lip and the skin of the chin to the submental lymph nodes. Few buccal lymph nodes may be present along the course of these lymph vessels. We have the muscles of the face أو اسمها الآخر هو muscles of facial expression embedded in the superficial fascia. Most arise from the bones of the skull inserted into the skin. يعني الأغلبية يكون origin مالتها from the bones of the skull and the base of the skull and the facial bones والinsertion مالته يكون بالسكن. So the muscles of the eyelids, the sphincter اللي هي orbicularis oculi, the dilator اللي هي levator palpebris superioris and the occipitofrontalis. We have muscles of the nostrils, the sphincter muscles اللي هي compressor nares. We have the dilator muscle اللي هي dilator nares. The muscles of the lips and the cheek, the sphincter muscle اللي هي orbicularis oris. The dilator muscle consists of series of small muscles that radiate from the lips. The origin of the orbicularis oris and insertion. We have some fibers arise near the midline from the maxilla above and the mandible below. Other fibers arise from the deep surface of the skin and pass obliquely to the mucous membrane lining the inner surface of the lip. Many of the fibers are derived from the proxenator muscles. The nerve supply, we have the buccal nerve and mandibular branches of the facial nerve. The action compresses the lips together. sphincter هي ممكن واحد من الاسم يعني يستنتج The dilators of the lips, the origin from the bones and fascia around the oral aperture, insertion the substance of the lips. The action separate the lips. This movement is usually accompanied by separation of the jaws. The nerve supply, the buccal and mandibular branches of the facial nerve. Traced from the side of the nose to the angle of the mouth and then below the oral aperture, the muscles are named as follows. The levator labii superioris, LEQ nasi, the levator labii superioris, the zygomaticus minor, the zygomaticus major, the levator anguli oris اللي هي deep to the zygomatic muscles, the rasorius, the depressor anguli oris, the depressor labii inferioris, the mentalis. بالنسبة للmuscles of the cheek, have the buccinator, the origin from the outer surface of the alveolar margin of the maxilla, and the mandible, opposite to the molar tooth, and from the pterygomandibular ligament, the insertion, the muscles fibers passes forward, forming the muscle layer of the cheek. The muscles is pierced by the parotid duct at the angle of the mouth. The central fibers decussate these from below, entering the upper lip, and thus from above entering the lower lip. طبيعي decussation يعني crossing. The highest and lowest fibers continues into the upper and lower lips respectively without intersecting. The nerve supply buccal branch of the facial nerve. The action compresses the cheek and lips against the teeth. هذا هو الجدول يلخص لنا المسلز والنيرف سبلاي مالتها والاكشن ورجينا insertion. قسم هنا إلى facial expressions, the dilator of the lips. بالنسبة للfacial nerve, as the facial nerve runs forward within the substance of the parotid salivary gland, it divides into 5 terminal branches. The temporal branch emerges from the upper border of the gland, supplies the anterior and superior auricular muscle. بشكل عام الفيشل the muscles of the expression and the facial muscle in general supplied by the facial nerve. So the temporal emerges from the upper border of the gland, supplies the anterior and superior auricular muscles, the frontal belly of the occipitofrontalis, the orbicularis oculi, the corrugator supercilii. We have the zygomatic branch emerges from the anterior border of the gland and supplies the orbicularis oculi. The buccal branch emerges from the anterior border of the gland below the parotid duct and supplies the buccinator muscles and the muscles of the upper lip and nostril. The mandibular branch emerges from the anterior border of the gland, supplies the muscles of the lower lip. The cervical branch emerges from the lower border of the gland and passes forward in the neck below the mandible to supply the platysma muscle. It may cross the lower margin of the body of the mandible to supply the depressor anguli oris muscle. هذه هي البلاتيسما والأكشن مالتها. Thank you.